We're going to go ahead and get started. Again, welcome. Thank you for braving the elements out there. We just did not want to cancel this a second time, so I appreciate your brave souls coming out. Thank you and welcome to Medicare Basics. We're happy to be partnering this morning with Lifelong and joined by Liza Berger. Liza is a health insurance information counseling and assistance program coordinator. Whew. Try that one more time. Health Insurance Information Counseling and Assistance Program Coordinator at Lifelong. Liza's background includes more than 25 years advocating for and supporting seniors as a social worker, activity director, and social work activity consultant in a skilled nursing setting. Most recently, serving in a leadership role as the director of social work at a local skilled nursing facility. Liza earned her MSW degree as a specialist in aging certificate from the University of Michigan. So my name is Diane Braddock, and I'm the Work-Life Consultant for Human Resources. Work-Life, our office is right here in EHOB, provides programs, consultations, and referral services for faculty, staff, retirees, and students with dependents on issues like life transitions, self-care, caregiving for children, elders, workplace flexibility, and a whole lot more. I'm joined today by my colleague, Amy Layton. Amy is the program coordinator for Work-Life. We also have an online audience today, about as many as are in the room today. Amy's assisting us with the remote technology and is the key contact for all our remote viewers. This Medicare workshop is designed to be basic. It's an introduction to help individuals become familiar with Medicare language, the definitions, and we'll be providing you lots of resources to learn more. Today we have a mixed audience, both their caregivers, endowed and contract employers, individuals who have Cornell benefits and do not, individuals who have children with disabilities, pre-retirees, people who are close to age 65, retirees, and people over 65. So as you can imagine, with that mixed audience, we won't be addressing a lot of specifics, but we're going to give you the resources so you can learn those specifics. So Cornell doesn't offer legal or tax advice, or we don't steer you towards any health insurance, healthcare decisions. This material is for informational or educational purposes only and should not be considered an endorsement. Decisions should be made based on your own individual objectives and circumstances. That's our disclaimer for today. So just a few housekeeping things. Be sure and sign in. Restrooms are out the door and to the right of the atrium around the elevators. We'll be sending you an evaluation at the end of today to get your feedback. And also keep us informed as to your questions, interests, and needs. So if there's things that are interest of you, there could be interest of lots of other people. We do about 25 to 30 programs every year. And so we want to make sure that those programs are designed to match your needs. Okay, so those participating online can submit questions to the Q&A or the chat feature, and we'll do our best to pose them to our presenters. So in addition, today we have Allison here from the Benefits and Transition Center. Right next door. Allison is going to help us address some of the Cornell-specific questions as retirees get close to benefit time or making some decisions. Their office, as well as the Aetna office, really does help guide some of those decisions. So Allison, if you'd say a few words first, and then we'll go with Liza.
Just wanted to point out for Cornell employees, you're going to be reviewing slides today that speak to Medicare Part D as in David. If you are enrolled in a Cornell health plan, whether on the endowed side, under Aetna, or on the contract college side with New York State for even like the Empire HMO plans, they do offer pharmacy coverage with your medical insurance. And that coverage through the pharmacy benefit is considered credible. So you would not want to enroll in a standalone Part D as in David plan, because that negatively will impact your current health coverage. Basically, if you enroll in a Part D plan and you're covered under the Empire plans or the HMO plans, it'll shut down your medical coverage completely. So you forfeit that. If you're on the endowed side and you have coverage either through Optum or through Aetna under the service center, that will shut down your medical as well. So it's really important when you're listening to the slides and you hear Part D, you have credible coverage and you get notices from Cornell that what you have is equal or greater than what Medicare can offer you. So try not to enroll in one, but fear not if you do. I will send you a letter because Social Security will let me know you enrolled, and I send you this dunning letter. So in the background, I'll catch you, but don't enroll in that if you can. And then for pre-retiree individuals who are getting ready to retire, if you're going to be retiring under 65, but you have a spouse or a domestic partner who's going to be 65, they need to enroll in Medicare. the same provision applies to them as well. They do not need Part D. They should only take A and B. Okay. And if you have any questions on coverage and enrolling, please contact our Aetna Retiree Service Center. That's what they're there for. They're happy to answer those questions because we don't want you enrolling in a plan that's going to negatively impact the coverage that you have currently with Cornell. Okay? Okay. Just my disclaimer for the day.
Okay. Thank you. Thanks so much. Welcome, everybody. So I hope that it won't be held against me that I'm a U of M fan. I know I am at Cornell here, but we're not big rivals. Thank you, Diane, for inviting me. I met Diane at another Medicare Basics session that was being offered at Lifelong. And I guess what I would start by saying is there's not a whole lot that is basic about Medicare. I learned this very quickly when I started this position. Before I get into this, I did want to mention one other part of my job. I'm also the coordinator of our tax counseling program that's offered through Lifelong. We have a site at Lifelong as well as in Trumansburg at the library. There is some information over with your handouts, and I think that Amy's going to share that as well. So if you are interested in getting free tax preparation, and you meet the criteria that we have, which are listed on that paper, we'd be glad to help you out with that as well. This presentation, I think the presentation that Diane went to at Lifelong was actually a 2-hour presentation. So I'm going to be cramming a lot into a short period of time. What I would suggest is, I know many of you may have questions, and Diane shared with me some of the questions that some of you may have. I would suggest that we wait until the end of the presentation, because what I find is many times questions get answered as we go along. So please take some notes. My hope of what you'll get out of this presentation today is a basic overview of a lot of information. The HICAP program, the Health Insurance Information Counseling Assistance Program, does offer free counseling. I have about a dozen volunteers who are certified and work with me to provide counseling for anyone who is interested in navigating the whole Medicare system. So first and foremost, I would really suggest that if you have questions after this, or you want to talk about your individual situation, that you contact us to come out for that. So what will we be talking about today? We're going to cover a little bit about eligibility for Medicare, how to enroll, or when you're enrolled automatically, some of the costs associated with Medicare, and what Medicare covers. We're going to be looking at original Medicare, which is also known as Medicare Parts A and B, as well as Medicare supplement plans, also known as Medigap plans, Medicare Advantage plans, which is another way to get your Medicare coverage, Part D prescription drug plans. Allison spoke to that a little bit already, as well as how benefits coordinate with other health insurance benefits that you may have. I'm also going to touch upon some cost sharing programs that can help pay for Medicare associated costs, such as Part D assistance with paying for medications through the EPIC program, an Extra Help program, and the Medicare Savings Program. So what is Medicare? Medicare is federal health insurance. It's administered by the Centers for Medicare and Medicaid Services. And as I mentioned, there are pretty much 3 parts to Medicare. One of the ways that I'm going to break this down, there are basically 2 ways that you can get your Medicare coverage. One way is through original Medicare, Parts A and B, and that's with or without a Part D plan that can be added to that, and with or without a Medigap or a supplemental plan. The other way that you can get your Medicare delivered to you is through a Medicare Advantage plan, which is also called a Part C plan. It's not often referred to as a Part C, but it is. And then, as I mentioned, the Part D prescription drug coverage
can either be an add-on if needed to your original Medicare plan, or were you to choose a Medicare Advantage plan, many of those plans already have the Part D drug coverage built into the plan. Who's eligible for Medicare? Any US citizen who is age 65 or older. If you're not a US citizen, but you've lived here for at least 5 consecutive years in the US and you're 65 or older, you're also eligible. Any disabled individuals of any age, once they've received Social Security disability for at least 24 months, they're automatically enrolled in Medicare on the 25th month. Or disabled individuals of any age with end-stage renal disease or ALS. So how do you enroll? Well, if you're already receiving Social Security benefits when you turn 65, you don't need to worry about actively enrolling because you will be automatically enrolled in Medicare. Typically, how you find out about that is 2 or 3 months before you turn 65, you will get your card in the mail and you will start to notice that your Social Security check is short $135.50 a month because they're starting to take out your Part B premium. If you're not receiving Social Security benefits when you turn 65, that's when you really need to take an active step to enroll in the Medicare program. And you can do that online. You can go right to Social Security. That's how you enroll. If, as I mentioned earlier, if you are receiving Social Security disability benefits for at least 24 months, you're also automatically enrolled in Medicare, and that would be effective the first day of the 25th month. So the key with this is, especially if you need to actively enroll, this can be a time-sensitive situation, and if you don't enroll when you're first eligible, then you will be assessed a penalty. So this shows you a little bit, and also if you're new to Medicare and you're enrolling based on your age, there is a handout there that's kind of a flow chart. That's a really helpful way to kind of navigate this as a starting point. But this shows you a little bit. When folks call me and say, when should I, I'm turning 65 on X date, when should I come and see you? Of course, I get some people who come, 8 months in advance because they're really thinking about it, and others who come and say, well, my birthday was last month. So what I usually suggest is that 3-month period before your 65th birthday month is a really good time to either come and see us, or if you want to do it on your own, get set up to enroll in Medicare in that time frame. If you enroll in those 3 months prior to your birthday month, then your Medicare is effective the first day of your birthday month. As you can see, if you wait and enroll during your birthday month, it's delayed, and your coverage will be delayed if you do it afterwards. But your initial enrollment period is a 7-month window, 3 months before your birthday month, and 3 months after, okay? You can enroll in premium-free Part A at any time after your initial enrollment period begins, but you can only enroll in Part B and premium Part A if you're someone that needs to pay a premium during your initial enrollment period and other limited times. So that's where you have to be careful about the penalty. So if you do not enroll in Medicare Part B, and you need to, and again, we're going to talk about, when some people might choose to delay that enrollment time. Say you miss that 7 months around your 65th birthday, you're not totally stuck because you would have an opportunity to enroll during the general enrollment period, which every year falls between January 1st and March 31st. The condition with that is that your Part B would not become effective until July 1st. So if you can enroll during your initial enrollment, that's best. And then there are also a number of special enrollment periods if you ever needed to make changes in your situation. I think there are 20 different special enrollment periods. So when in doubt, if you feel like you need to make a change in something, there's likely a special enrollment period that can help you out. So as I mentioned, you can enroll in premium-free Part A at any time after your initial enrollment period. As long as you have paid into FICA taxes for at least 10 years, then you are eligible for premium-free Part A. So even if people decide to delay enrollment in Part B, most people, there's no downside to enrolling in premium-free Part A. Also, that applies to your spouse. So if you yourself haven't paid in 10 years, but your spouse has, then you are eligible yourself for premium-free Part A. If you have not contributed to FICA taxes for at least 10 years, this shows a little bit about premium Part A, how much you would have to pay based on how much you paid into the system. So you can see the red letters here, and that's where it gets really important. People sometimes get confused between when you can defer Part B if you have current active employer coverage versus retiree coverage. So those are very different situations. So first of all, the reason why you would want to consider deferring enrolling in Part B is because, it's, as I mentioned, there's going to be a premium for Part B. It's the $135.50 would be the minimum, and it could go up from there depending on your income. So if you are ready to enroll in Medicare due to age, and you find that you are covered by your or your spouse's current active employer health insurance, then you may have an opportunity to delay that enrollment in Part B. I will say that you still want to take and play an active role in that. So when you go to enroll in Medicare, there is a place that you can say, I choose to delay my enrollment in Part B. You don't just say, well, I'm just not going to enroll at all. Okay. Again, the third point here, just make a note that COBRA and retiree health insurance coverage are a totally different bag. Those are not considered current active, through current active employment. If you are delaying your Part B enrollment, say you turn 65, you delay that enrollment because you're currently and actively employed and have insurance through your employer, and now you're contemplating retirement. That's a good time also to talk to someone like Allison and discuss how that will work with your retirement plan. But you must enroll in Medicare Part B within 8 months of losing that current active employment insurance so that you avoid a penalty for Part B. If you don't enroll within the 8 months, then you have to, again, wait until that general enrollment period, as we discussed, January 1st through March 31st, and your effective date would not be until July 1st. So I'm going to talk a little bit about original Medicare Parts A and B and what they cover. If you have original Medicare that is accepted anywhere in the United States, as long as the provider participates with Medicare. So that's convenient for some people that are not worried about being in a network of providers, but want to make sure they have coverage everywhere that's the same no matter what state you're in. Original Medicare has two parts. Part A is the hospital insurance. Part B is your medical insurance. Typically, Part A focuses on inpatient hospital care, skilled nursing facility care, and again, that's for skilled care, not custodial. It also pays for home health care services and hospice care. This shows you a little bit about the associated costs with Medicare Part A, including the deductible for inpatient hospital stays. There are a number of lifetime reserve days if someone were to exceed day 90 in a benefit period. And there is something that's interesting to note with original Medicare A and B is there is no out-of-pocket maximum in original Medicare. The other thing to note is, as I said at the bottom, A lot of times people assume if they're going to the hospital that Part A is going to cover everything, but actually your Part B insurance would pay for your doctor's services even while you're in the hospital. Medicare Part B covers outpatient services, your doctor's visits, labs, preventive care, were you to need a wheelchair or a walker. If that equipment is ordered by your physician, that would also be covered for Part B. In some instances, Part B also contributes to home health care, x-rays, and your therapy services. This shows some of the costs associated with Part B. As I mentioned, the premium for 2019 is $135.50 per month. If you have a higher income, then the premium is adjusted based on your income. Once you meet your deductible for Part B, then typically what happens is that you will be responsible for 20% of your bill. So Medicare will pay 80%. You are responsible for that 20%. And I'm going to talk a little bit about Medigap or supplement plans that some people get to help cover those costs. This shows a few of the preventative services that Part B covers. One of the things I want to mention with this is there are many different screenings and visits provided on here. What you need to be careful of is that if you go in for a cardiovascular disease screening, for example, that may be covered by Part B for the screening. Were you to find that you have a health issue related to cardiovascular disease and they're looking at diagnostics or other treatment for that, that would be a separate expense. Good to note the flu shot is covered under Medicare Part B. So a few things that original Medicare, again, A and B, does not cover. They do not cover long-term care. Again, we talked a little bit about skilled nursing, but not custodial. They don't cover most dental care unless it's a health concern. They wouldn't cover routine dental care, for example, or fillings. Eye examinations related to prescribing glasses, dentures, any cosmetic surgery, sorry about that one, acupuncture, hearing aids and exams for fitting them, and podiatry. The one that often people ask about is dental, vision, and hearing, that those are not services that are typically covered under original Medicare. So we talked about original Medicare and that typically that would pay for 80% of Medicare services. Some individuals choose to purchase a supplement plan or a Medigap to help cover some of those additional costs that they end up paying. Medigap plans are sold by private companies. As I mentioned, they may pay some of those healthcare costs that Medicare doesn't cover, like copays or coinsurance or deductibles. Some of the Medigap plans, were you to travel outside of the United States, may cover some services that your original Medicare doesn't cover. So again, original Medicare would be your primary, Medigap would be the secondary that they would bill. A Medigap plan is different from a Medicare Advantage plan. So again, I talked about two different ways to get your Medicare delivered to you. Right now I'm talking about original Medicare, A and B, with a supplement possibly. The other way that you can get your Medicare delivered to you is a Medicare Advantage plan. In order to enroll in a Medigap plan, if that's something you choose to do, you do have to have both parts A and B, okay? If you and your spouse both would like a policy, those are two separate policies that you would need to purchase. As I mentioned, with original Medicare, Medigaps work the same way in terms of being portable, that you can use a Medigap plan with any provider who accepts Medicare in the United States. The last point here, and this is where it's helpful too to just consider a high cap appointment if this is something you're interested in. But the Medigap benefits are standardized. So this was one thing that I learned very early on. The Medigap plans are designed by different letters, not A, B, and C though. And different letters have different levels of service and coverage that they provide. So of course you pay more, the more service that you want with a Medigap. But what I found is I believe there's about a dozen insurance companies that provide plans. So if you choose, for example, I want a plan G, this is the coverage I want, you really want to take a close look at that because some of the plans may charge $200 premium a month and some may charge $400. A letter G plan is a letter G plan is a letter G plan. So unless you feel really strongly about a particular company, it's important to look at that because you're going to get the same coverage no matter what you're paying for it. As I just mentioned, you are going to have to pay an additional premium if you want a Medicare supplement plan or a Medigap. Medigap policies do not cover prescription drugs. That would be a separate Part D policy, or you may have drug coverage through your employer. In New York State, those who are under 65 and receiving Medicare due to a disability are eligible for a Medigap plan. And unlike original Medicare, when there are certain times that you'll need to enroll, you may enroll in a Medigap plan at any time during the year. As long as you have A and B, in New York State, you can enroll at any time. That's not true for all states. So what to consider if you're considering going this route of original Medicare and maybe adding a Medigap plan? You need to check and see if it's affordable. Like I said, the premiums can be up there. These are monthly premiums, and these would be in addition to what you're paying for Medicare Part B. You need to decide whether the coverage that's offered is worth the additional cost if you're paying more for that. Again, if you have a particular impression of the company you want to go with, that's something to consider. And also some plans may have a clause about pre-existing conditions. So that's something you'd want to check into. All right, we're skipping over C. We've done A and B in our Medigap, but I'm going to jump right to Medicare Part D and talk a little bit about that, and then go back to the Medicare Advantage plans or the Part C. Medicare Part D, again, this is the one that makes sense, D for drugs, okay? This is your prescription drug coverage. This is an optional plan, so you do not have to enroll in it. However, there are enrollment periods for Medicare Part D. It offers outpatient prescription drug coverage for anyone with Medicare. Part D plans are only available through private companies. I want to just comment, and where I say it's optional, though recommended to avoid incurring future penalties. If you have creditable drug coverage through another plan, you're not going to incur a penalty, but you should, Allison said, you know, you should get a letter every year that says that the drug coverage you have through Cornell is creditable and not worry about that. The other thing I want to say about Part D coverage is if you're going with an original Medicare plan and you want to add a Part D plan, you could get that through a standalone Part D plan. If you choose to get your Medicare benefits through a Medicare Advantage plan, many of those plans already have a Part D plan that is built right into that. To enroll in Part D, you must have Parts A and B. You must live in the plan's service area. You may not live outside of the United States. You may not be incarcerated. Some individuals, we're going to talk later about the Extra Help program. If somebody's enrolled in the Extra Help program, they may be automatically enrolled in a Part D plan. One of the things that I recommend, if you haven't checked this out, you can do it with us or you can do it on your own, but to visit Medicare.gov there's a tool called Plan Finder. And what you can do is you can enter in any medications that you take. You can put in your preferred pharmacy, and then they will pull up Part D plans, standalone Part D plans, or Medicare Advantage plans with D that have your medications included in their formulary. So that's kind of fun to play around with if you're a high cap coordinator. So there are a bunch of standalone Part D plans in New York. There are 23 this year. And again, the premiums and deductibles are all over the place. So that's where it's helpful to look at your specifics. Of course, you can't always predict what medication you might be put on in the future. There are options to make changes if you need to. But by using that Plan Finder tool, it can help you to determine what the deductibles are and how the plans work. So, as Allison mentioned, through Cornell's health insurance plans, they include a prescription drug component. I won't say Part D component because it's not Part D, but it is a prescription drug component. That is considered creditable coverage. So as long as you have that coverage, you do not need to get a Part D plan. If you have that coverage through current active employment and you're planning to retire and your retiree coverage does not have that component, then you have a 63-day period within which to add Part D onto your Medicare coverage without being penalized. If you are penalized, that's the penalty that you'll incur. Okay, so the second way that you can get your Medicare benefits delivered is through a Medicare Advantage plan, also known as Part, anyone? C. So this is still part of the Medicare program. And what it is that the federal government pays subsidies to private companies to put together a health coverage package to their beneficiaries. So some of the main differences between this and original Medicare is that typically with a Medicare Advantage plan, you're working with a network of providers. So the first thing you want to consider is who's your primary care physician? Do you see any specialists, and do they work with the Medicare Advantage plan that you're considering? The plans vary from county to county. So if you've moved here from a different area, one of the things that we provide at HiCap, and I brought a sample of it today, not in a handout form, but we do a nice handy dandy spreadsheet that compares all of the different Medicare Advantage plans with or without Part D. So you can compare apples with oranges versus trying to go online and looking at each different plan's website. If you join a Medicare Advantage plan, you still maintain your Medicare coverage. You receive all the benefits covered by A and B, but they are just covered differently. So in order to enroll in a Medicare Advantage plan, you still have to have Medicare Parts A and B, okay? As I mentioned earlier, many of the plans already include prescription drug coverage. They may have different benefits and cost sharing. As I mentioned earlier, with original Medicare does not pay for any dental services, vision, hearing. What I'm seeing more and more is the Medicare Advantage plans are branching out. So they might have an allowance of up to X amount for vision or for dental. So that is appealing to some individuals. So when you're in your initial enrollment period, that's a time that you can also consider enrolling in a Medicare Advantage plan if that's of interest to you. Typically how that works is that someone will, in the ideal world, in that 3-month period before your 65th birthday month, they will enroll in A and B. And then they can, once we get that Medicare card that shows they have A and B, they can then enroll in a Medicare Advantage plan. Another opportunity to enroll in a Medicare Advantage plan is during the annual enrollment period, which is October 15th through December 7th every year. One of the things that you'll notice that this is coming up because you'll start seeing commercials or people at the pharmacy with a booth set up. Everybody is kind of sharing their plans and why they feel that their plan is the best. So that's how you know we're gearing up for the open enrollment period. But that's an opportunity, as someone called it in my office, it's open season on Medicare. So that's a time to be able to make some changes in your plan. If you make a change in the annual enrollment period, it becomes effective the 1st of January. And again, as I mentioned, there are several special enrollment periods, I think 20 of them. So if you need to make a change outside of those other timeframes, we can look at that. I mentioned earlier the Medicare.gov site. So if you go on that plan finder tool and you find a plan that looks appealing to you, you can actually enroll right through that site. What Allison was referring to earlier with the prescription drug coverage is that if you enroll in either a standalone Part D plan through this program or a Medicare Advantage plan with Part D, that's going to negate other coverage that you have that has prescription drug coverage. So that's where you need to be really careful. And again, I've put us down there for high cap. So if this is something you'd like somebody to walk you through, we're happy to do that. The thing that's nice about our program is that we are non-biased. So we have a spreadsheet, like I said, that compares all of the plans versus just hearing about one plan or reading, you know, maybe a Medicare Advantage plan. One does a better job on their website versus the other, but this compares all of those. So if you're trying to weigh out what should you go with, Medicare Advantage plan, or maybe I want to stick with original Medicare, one thing you should think about with Medicare Advantage plan is you must have A and B, okay? There may be an additional plan premium. Some of them have a $0 premium, so the only cost would be the cost you're incurring with the Part B premium. There may be no other cost, you're just getting your Medicare delivered differently. Most of them offer comprehensive drug coverage through Part D. Most use networks of providers. So again, you want to check with any physician or specialist you use to make sure they're in network. Sometimes some of the plans have in-network and out-of-network costs when you go to the doctor, so you could still go out-of-network, but you might have to pay a little bit more for that visit. Some plans require a referral to see a specialist. Medicare Advantage plans are not available for those with end-stage renal disease. One other thing to note about Medicare Advantage plans is that there's another enrollment period between January 1st and March 31st. So if you, say during your fall open season, you enroll in a Medicare Advantage plan and you decide in February, oh, I didn't realize that my provider was out of network, or I need to make a change, there is a chance to either switch to another Medicare Advantage plan or to go back to original Medicare. So you're not stuck. If you want to try something out, there are some time frames that'll, of course.
We just want to add one little piece of Medicare Advantage. Cornell Retiree plan, we offer the standard 80/20 plan, which is secondary to Medicare, but we also offer a Medicare Advantage plan with Aetna, which is specific.
So sorry, I forget this. That's specific to Cornell's plan. It's not a Medicare Part C. You don't enroll through the Social Security office. When you retire, you'll receive information to either take the 80/20 plan or the Medicare Advantage plan. And both of the pharmacy components with that have a wraparound for the Medicare Part D, so you still pay your copay that you're familiar with paying. So there is no Part D where you're paying higher than your standard copay you're used to. So when she's talking about Medicare Advantage, that's if you purchased a Medicare Part C plan directly with Social Security. Some individuals in this room may have Medicare Advantage that Cornell offered you at retirement. That is different, and we subsidize that pharmacy piece. Okay, so just wanted to clarify that point. It's confusing.
Say that again. Okay. So we've talked a little bit about how the coordination of benefits may work if you are currently actively employed and have employer insurance. I did just want to say that there are, if you have retiree insurance, it's a different picture. You still need to have parts A and B to access your retiree Medicare option. So very often, and again, it depends on the plan, but a lot of times what we see is that when people retire, they may have original Medicare A and B, and their retiree insurance almost works as a Medigap or a supplemental plan. And again, whenever anybody comes to our office and is asking, what should I do? Should I drop this? Should I keep that? If there's retiree insurance or current active employer insurance, we are always directing you to go back and meet with your benefits department, because we cannot pretend to understand all the intricacies of all the different plans that are out there. So you need to be well informed of what you're signing up for. So one of the things that probably was pretty apparent is that Medicare doesn't cover all of your costs. There are options for you can assume some risk. I have worked with individuals who have elected not to get Part D coverage and don't have coverage elsewhere, and they say, I don't take any medication, so I don't need that. Again, that's an optional thing, so you don't have to have that. But we definitely don't encourage that. We encourage people to have some drug coverage. These are all other services that can help supplement the costs of Medicare coverage. Again, we mentioned a little bit about employer coverage, active or retiree, veterans benefits. For those some individuals are on Medicaid that would almost work as a supplement to Medicare. There's a program called EPIC that you may have heard of, and we're going to talk about that. It's the elderly pharmaceutical insurance coverage that can help with paying for medications. A program called Extra Help, also known as Low Income Subsidy Program, and the Medicare Savings Program. Let's talk just a little bit about the EPIC program. This is a New York State program. It provides secondary drug coverage and premium assistance for seniors with Medicare Part D. Now, there are some other drug coverage programs that EPIC does work with, but if you have drug coverage through a different program, we would need to contact EPIC to see if they participate with them, if it's not a Part D plan. You're eligible for EPIC if you're 65 or older, you live in New York State, and you meet the income requirements not exceeding $75,000 for an individual or $100,000 for a married couple. You qualify if you're not receiving full Medicaid benefits, and as I mentioned, you need to be enrolled in a Part D plan, or we would need to contact EPIC if you're in a different prescription drug plan to see if they participate. And we have, by the way, all of these programs that I'm discussing, we have the applications and the screening tools at HiCap to help you determine if you'd be eligible. Extra Help is another program. It's a federal program that's administered by the Social Security Administration. This also helps with Medicare prescription drug costs, including deductibles, premiums, co-pays for people with limited income and resources. The Extra Help program screens by looking at both income and resources. I don't yet have the cutoffs for 2019, but these are the limits for the 2018 Extra Help program. There are two levels of extra help. There's full extra help or partial. If you qualify for this program, then you get help paying your Part D costs. You have no coverage gap, known as the donut hole. So some of you may be familiar with that. There's no late enrollment penalty. So if you did not sign up for Part D in a timely fashion and you jump on board later and you are eligible for extra help, then any penalty will dissolve. And there's a mistake in this last one. This was last year was the case that you could switch plans at any time. Now it's once per quarter. So if you are enrolled in extra help, you have a chance to switch quarterly. Medicare Savings Program is another program that can help with costs for low-income individuals. With this program, the screening does not include looking at assets. It only looks at your income. So this is a program that's administered by the Department of Social Services. It helps with paying your Medicare premiums. So depending on, if you're eligible for this program and depending on which level, they may pay you back for the Medicare Part B premium. So that $135.50. The nice thing about the MSP program is that if you qualify for the Medicare Savings Program, then you're automatically enrolled in the full extra help. So it can be kind of a double whammy and help you on both ends with both your medications as well as your Part B premium. These are the 2018 income limits, which they're still using for the MSP program. And this shows the three different levels and what they cover. So you can see with the first one, which is the lowest income bracket, that would cover A and B if you had a premium A, any deductibles and co-insurance, whereas the others may just cover your Part B premium. So a bunch of things to remember. Medicare is a federal government health insurance program. It does have private company aspects. It doesn't cover all of your health care costs, so it's important for you to be involved in the decisions you're making on this. There are assistance programs available for people with limited income and resources. You want to be aware of penalties in terms of when you want to sign up for different services. It's suggested that you review your plans every year. So when you sign up, don't think you're done then. I really encourage people to revisit it every year. We call it a Medicare checkup when it's open enrollment time, because things may change. Other plans may be out there that are better suited for your situation. In New York State, you can enroll in a Medigap plan or a supplement plan or the Epic at any time during the year. Interesting to know, with the Epic, if you are enrolled in the Epic plan, that also allows you one special enrollment period in the year to make another change. So a lot of people choose to enroll in the Epic plan for various reasons, but it also allows them some flexibility if they want to make a change outside of the other enrollment periods. And in New York State, eligibility for the Medicare Savings Program, again, is based solely on income. It does not include your assets. So of course I have to toot the horn of our high cap counselors, but I had somebody in last week and he was new to Medicare and kind of navigating all of this, and he said, how are people supposed to figure this stuff out on their own? I mean, it's a lot of information. So please don't hesitate. I mean, these are times that you might consider coming in and meeting with myself or with one of our counselors. That 3-month window prior to becoming Medicare eligible due to age or disability, so you can explore your options and what you need and want for your individual situation. Maybe you're contemplating changing your health insurance coverage. You're planning a retirement, or you've moved to the area and you want to consider what options are available to you. That's a good time to come talk to a counselor. Fall enrollment period, which is October 15th through December 7th. If you want non-biased information on all the plans that are out there and access to our handy dandy spreadsheet, come on in and see us. I'm also happy to share that spreadsheet with people. If you don't want to come in for an appointment, but you want that information, I'm happy to do that. If you want to determine whether you're eligible for assistance in any of the programs that might lower your healthcare expenses, we're happy to help with that. And then again, very often during open enrollment, comparing the costs and coverage of, either original Medicare versus your Medicare Advantage plans. That's a good time to come and see us. So in your packet, I listed a bunch of different resources that may be helpful to you, as well as information to reach out to Allison if you had questions about benefits. So I know I just plowed through a lot of information. I see a couple of glazed over looks, but I wanted to make sure that we had a chance to respond to any questions that you might have. Yes. Oh, do we need to pass this around? Or? I'm sorry.
The B premium, plan B premium rate, same in all 50 states?
Yes, it is. I'm sorry. He's asking if the Part B premium, monthly premium, is the same in all of the United States, and it is. Again, it's $135.50, but it can go up from there depending on your income. Yes. So Epic has a two-part program. They have a fee plan. Honestly, I can't remember what the other name of the plan is, but so there are two different plans, and it's based on your income. So again, I have those applications for you, so you can look at that. For some, there's no cost. Right, so the question is, for Epic, purposes of Epic, is the income you're looking at just income or assets? It is income only. Yes, it does. Mm-hmm. It includes Social Security. Okay, Amy?
This is actually for Allison. If I am the Cornell employee, but my spouse reaches 65 and is not a Cornell employee, does he still have prescription coverage from Cornell? Does he have to get coverage elsewhere?
Oh. We have to share. Okay, so if the Cornell retiree has a spouse who's covered under their retiree health plan, is turning age 65, they do need to enroll in Medicare Part A and B, and they also have coverage under the medical plan and the prescription benefit. As long as they're a covered dependent, it's not a problem.
Yes. So the question is regarding paper flow, and the paper is coming from all angles, or how would you? Yeah.
It's just the way the process goes. Yeah, so when you go to a provider who participates with Medicare, they submit the bill to Medicare, and then the providers many times will turn around and bill your secondary, which is for you, the Empire plan. Other providers may not, and you have to do that, but there is no automated process for that. You have to bill them independently, and then you get your bill. And I always recommend, before you ever pay a bill, you validate how much was paid by Medicare and how much was paid by your private insurance, because you want to make sure that you're not being overcharged, and you want to pay what's on those explanation of benefits. So I know it's a little cumbersome, but there's no easy way. Yes, you should.
Yes,
always
yes, you
review
should.
those. Yes,
Yeah.
always.
Yeah.
The other piece that I would say about that is making sure every time you go to the doctor that they have exactly your cards, because if they only bill Medicare, for example, and then you get some huge bill, you may need to contact them and say, please remember that you need to, Empire Secondary, so they need to be billed for this. It's a lot to navigate.
I consider it like Go Fish when you were younger and you played that game. You have to literally match things up when you get the bill. How much did Medicare pay? It's going to be right on that explanation, or the bill, excuse me. And then how much did Empire pay? And then now you know what your responsibility is out of your pocket. Well, it depends on what services you're seeking. X-rays could be different from a doctor versus a hospital, so they could be different. Well, I always say you match what you have the bill for, because sometimes providers are just billing you because they're on a monthly billing cycle before they're getting the reimbursement from Medicare and Aetna. They're just automatically sending you a bill. So you just want to make sure. But the good news is usually when you overpay a provider, they'll either stick that amount in a credit or they'll give you a refund. So, but you have to match.
I'm one of those fortunate children that have 6 parents that are over 65, all struggling with this as well. What we ended up doing is setting up an organization system, and we literally have a notebook. Every time they do a visit or they have something or they fill a prescription, and they have all the different numbers. There's 800 numbers all listed down, but also it's like literally a diary of everything that they do, everything that they receive, all their services and so on. And then they try to match a lot of the invoices and a lot of the statements accordingly. They had to really get very precise with what is a statement versus an activity record versus an invoice versus a payment. And so there were some really distinct differences. So it is something that you have to really pay close attention to, stay on top of, organize, and if you have questions, contact the numbers on those forms.
Yes.
I'd like to try to ask again the question I just was asking, but I think that is,
Okay.
which is, if you've already got middle coverage now, when you move to Medicare plus whatever, are you likely to pay more or less, or about the same?
I can't speak to the Cornell piece.
Yeah, that's fine. So for individuals in the room that are covered under the Empire plan as a retiree, your benefits are offered by the state of New York, and all taxpayers are paying into that plan. So that plan is rather rich because they reimburse the Medicare credit, your full sick leave credit gets applied. They also will reimburse your spouse's Medicare Part B premium. So when you're saying the cost, I think under the Empire plan, because it's a state plan, they're extremely generous because they have all the taxpayers contributing. Okay, so I think that's a good plan. The Cornell endowed plan, those plans are based on endowments. So from Cornell's perspective, and that's why we offer the generous benefit with Medicare Advantage in a retirement status where you only pay a copay. We made those benefits quite rich. And if you go to a hospital for hospital admission, you just have a straight $250 that you pay regardless if you stay there 1 day or 3 months. And it's per occurrence. So Cornell has come in and we have designed that plan to meet what we want to offer our retirees, which is a copay structure. We do the wraparound for the Medicare Part D to get, again, the copay structure for you. So I can't compare like Borg Warner or other employers that have benefits out there, but I can say that Cornell in general is very rich in their benefit giving. So, and as a retiree, is if you drop that coverage for any reason, you forfeit it for life. So you have to be very careful with that decision.
Okay, we've reached that magic hour. I know that there's lots of questions. And so we're going to hang here. Those who can stay online, stay online. Those who can stay. We'll be here for the next half hour. We have the room available. But those of you who need to depart, please do. Thank you very much for attending. It looks like the snow globe has settled a little bit. So again, we appreciate your coming.